Hey, future doctors! I'm here to challenge you with 20 must-know pathophysiology questions that you absolutely can't miss if you want to ace your exams. Let's dive right in and see how well you can do. Question 1. What is the primary pathophysiological change seen in type 1 diabetes mellitus? If you answered autoimmune destruction of pancreatic beta cells, you're absolutely right. Moving on, question 2. What is the hallmark sign of congestive heart failure? Yes, it's pulmonary edema. Keep it up. Question 3. Describe the mechanism of action for aspirin in cardiovascular disease. It's an antiplatelet effect by irreversibly inhibiting COX-1. Spot on if you got that. Question 4. What abnormal protein accumulation is characteristic of Alzheimer's disease? That would be beta amyloid plaques. For question 5, what is the main risk factor for the development of squamous cell carcinoma of the lung? Smoking is the correct answer. Let's ramp it up a bit with question 6. Name the genetic defect in cystic fibrosis. It's a mutation in the CFTR gene. Great job if you remembered. Question 7. What electrolyte imbalance is most commonly seen in acute renal failure? Hyperkalemia is what you should have said. Question 8 asks, what is the major cause of anemia in chronic kidney disease? The answer is decreased production of erythropoietin. Question 9. Which hormone is primarily involved in the pathophysiology of diabetes insipidus? That's ADH, or antidiuretic hormone. And for question 10, what is the pathophysiological process that leads to asthma exacerbation? It's bronchial hyperresponsiveness leading to obstructive airway disease. We're halfway there. Question 11. What type of hypersensitivity reaction is rheumatoid arthritis? It's a type 3 hypersensitivity reaction. Question 12. What is the typical pathological finding in Parkinson's disease? Loss of dopaminergic neurons in the substantia nigra. Question 13. In multiple sclerosis, what part of the neuron is primarily affected? It's the myelin sheath. Question 14. What is the common cause of peptic ulcer disease? Helicobacter pylori infection. Almost there. Question 15. What physiological change is indicative of compensatory shock? Increased heart rate. For question 16, what is the effect of high altitude on blood oxygenation? It causes decreased hemoglobin saturation. Question 17, which inflammatory markers are elevated in systemic lupus erythematosus, ANA and anti-dsDNA? Question 18, what is the leading cause of preventable blindness in the world? Trachoma. Question 19, what is the primary defect in osteoporosis? Decreased bone mass density. And finally, question 20, what is a key pathological feature of acute myocardial infarction? Myocardial necrosis due to ischemia. I hope these questions helped sharpen your knowledge and prepared you for tackling pathophysiology with confidence. Keep studying hard, and you'll be ready to ace those exams.